Hello, everyone, and welcome in. Settle in. Thank you for watching Senior Living Live. My name is Melissa. I hope, as always, you are having a fantastic day today. Now, if you have a loved one who has been diagnosed with dementia, this is a webinar that you will want to be a part of. We will try to help you answer the question, when is it time for long-term care? Yalily Smith, the owner of The Traveling Therapist, she joins us today to help provide you with a checklist to help you and your loved ones make that decision at the right time, not too early and not too late. We will open it up for questions at the end of the presentation. You can just scroll down to the bottom of your screen where it says Q&A. Type your questions out there and I will be happy to read them to you, Lily. As always, you can remain anonymous. Yalily, thank you so much for joining us today and for sharing your knowledge with us. The webinar is all yours.
Thank you, Melissa. I appreciate it. All right. Hello, everyone. I am very happy to do this presentation for you all. I'm going to go ahead and share my screen here momentarily. A little bit about my background. I am a licensed clinical social worker, and I have been working with patients suffering from every variety of dementia for the last 7 years. I also cover family therapy, couples therapy, individual therapy, trauma, among a whole slew of other types of therapy styles. Today, we're going to talk about maybe some of the questions that you have regarding dementia, regarding your loved one, and the question of placement. I'm going to start with answering the question, what is dementia? And dementia is actually not a specific disease. It is a combination of a number of conditions that impair the person's brain function. And some of the things that we find in this impairment is memory loss, confusion, difficulty with judgment, problem solving, definitely difficulty making decisions, especially relevant decisions for life changes. Some of the more common types of dementia that I have worked with are Alzheimer's, which is predominantly based on age and typically starts somewhere after the 60s. Then we have vascular dementia, which is often known as major neurological decline. And this can happen either due to a stroke, a car accident, it can be due to seizures, history of diabetes. So vascular dementia is any form of dementia where the person actually incurred a trauma to the brain, where they were without oxygen to the brain for a long enough period of time that the brain suffered significant functional diminishing factors. This can actually happen at almost any age. And so because we don't expect it to happen in younger people, it's sometimes difficult to accept vascular dementia when it happens for people in their 30s, people in their 20s, etc. The last one is Lewy Body. And Lewy Body is a type of dementia that's associated with Parkinson's. Now, it is not exactly proven whether Parkinson's starts before Lewy Body or Lewy Body starts before the Parkinson's, but it is one typically starts to relate to the other. And so the person with Parkinson's, you will start to notice that not only do they start to decline physically, but their cognitive capacity also declines. Next, I'm going to talk very briefly on the stages of dementia. There are 3 stages of dementia. We, of course, consider the 4th stage as end of life because dementia is a terminal illness. And to this day, there is no actual cure that has been found. Now, the early stage, some of the things that you might find when the person that you are working with, parent, child, loved one of any kind, spouse, friend, when you're working with that person during that early stage, that onset stage, you may start to identify that the person's having a bit of a hard time coming up with the right word or name for something, for an animal, for a place. Now, the more the disease progresses, the longer it takes for the person to remember the correct term, name, or word for people and things. And I want to just give a bit of a caveat on this. What is the difference between a person developing dementia, demonstrating forgetfulness of terms and words and names, versus just a basic brain fog situation where, hey, I just happened to forget this one place or this one word, et cetera, et cetera. There's two factors here. Number one, if a person just happens to forget a word, for example, if they don't have dementia, they should be able to, if they slow down in a few seconds or maybe a couple minutes, they can actually remember it. Now, the other thing is if you're just having a brain fog day, you should be able to actually backtrack your steps and problem solve till you find the correct term or name for that you have forgotten. So a person with dementia, on the other hand, not only can they not remember the word, they cannot remember that they need to remember the word. So let's say that I forget the word dementia and I'm trying to describe it and I'm trying to pull it up and I'm trying to think about it. But in a few seconds, or maybe a few minutes, if it's very early stages, in a few minutes, I'm going to get distracted with a different thought. And the whole concept of trying to remember the word dementia is just going to go away. And so you're going to ask me maybe an hour or two later, hey, did you remember that word that I asked you about? And I'm going to be like, what word? The one that you were supposed to. Oh, no, I'm not sure. So that's the difference between memory fog and dementia. Another is having difficulty performing tasks in social or work settings. And when I'm talking about that, I'm specifically talking about tasks that require multiple steps and problem solving. So, say, for example, it's your turn to cook dinner tonight. That requires multiple steps. It requires remembering that you turned on the oven. It requires remembering what temperature the chicken has to be cooked in, and et cetera, et cetera. So anything that requires multiple steps, you will start to notice that the person has some difficulty performing. Next, forgetting material that was just read. So you're just finished watching a movie, but you don't really remember the plot or any of the characters. Losing or misplacing things. We all lose things. We all misplace things. But is this person losing things and then becoming extremely agitated? And even if they just recently lost it, they just cannot retrace their steps. They can't say, well, I went first to the bedroom and then I came out here and I went to the kitchen. They can't even remember that much. So they can't problem solve finding the item because they can't retrace their steps. The next one is experiencing increased difficulty with planning, decision making, and organizing. Something that you're going to start to notice if you have regular interactions with the people that in your life that may be experiencing dementia is they're going to start asking you a lot of questions. What are you going to get for dinner? Maybe you guys are at a restaurant. They're looking at your menu. What do you think is good here? What are you going to get for yourself? What do you think I should get? They're going to have a hard time making those decisions for themselves. Um, do you think we should go to the park? Do you think we should watch that movie? Because they're going to be a little bit confused as to decision making, even for basic things. Now, when you enter moderate stage, you're going to start to notice the person being forgetful of events or personal history, especially recent. A lot of people with dementia in the advanced stages and moderate stages can get away with confusing their loved ones or making the loved ones feel that they're perfectly okay because they can remember past memories and they can remember past events very well. But if you talk to them about what they did a week or two ago or what they did a few days ago, they might have a much harder time. They might, people in moderate stage will feel moody or withdrawn, especially in socially or mentally challenging situations. That's when you start to see, not so, your loved one will not want to leave the house as often. They won't want to go and participate in activities that they used to as often. Anything that requires them having to have conversations or interactions where they might be tested because they'll have to remember something recent, they're going to try to avoid. The next one is being unable to recall information about themselves, like their address or telephone number. I do feel like this is closer to late stages. Telephone numbers, social security, date of births, addresses, things like that have been pretty much kept in our long-term memory bank for so long that most people should be able to remember it pretty late into the dementia phase. So don't be fooled. Now, if you ask them the date and time and the current year, current president, etc., on a regular basis, that would be a little bit better. The next one, experiencing confusion about where they are or what day it is. As I explained, where they are, what day it is, how they got there, the name of the town, the name of the city, etc. Requiring help choosing proper clothing for the season or the occasion. Most of the time, by this point in the stages, the person is no longer able to make those kinds of decisions for themselves. Again, they're back to decision making. Anything that's decision making that has more than one or two choices can become extremely overwhelming. So at this point, we're talking about choosing, a jacket because it's cold outside may feel a little bit too far to go in terms of like problem solving. So they'll just wear the same clothes over and over and over again. The person might also forget what clothes they were wearing the day before. Increase wandering and becoming lost. Definitely watch out for your loved one driving when they have been diagnosed with dementia or when they are showing symptoms of dementia, because anything that doesn't seem entirely familiar is going to confuse them. And so I've had quite a few cases of people that have gotten lost driving from the grocery store back to their house because there was a detour on the street and there was construction, or due to traffic they couldn't merge fast enough and they ended up going to the wrong street and now they're completely lost. Another one is demonstrating personality and behavioral changes, including suspiciousness and delusions or impulse, repetitive behavior like hand wringing or tissue shredding or picking. So anxiety is typically one of the signs of this particular stage. The person is very, very uncomfortable because they're aware that they are not entirely with it. And they're really trying hard to prove that they are, because no matter what happens, they still understand that there's a stigma associated with this. that there's a possibility of somebody finding out and they're going to have to leave their home. That's a very real fear that people have when they start to develop dementia. They are more aware than we can ever believe or understand of what's happening in their own mind. They just won't share it with us. And so you will see the anxiety, checking the clock, the checking the calendar, um, the weather, asking questions. What time am I supposed to be going to that appointment? Is that appointment today? Are they supposed to be picking me up? Getting ready hours ahead of time. So you'll start to see that. You'll also start to notice maybe the person becoming very paranoid. Oh, well, you're just gonna take all my money. You're doing that because you just want to take all my money. Why are you here? Who are you? Why did you come into my room? So you'll notice things like that. In the late stages, the person requires around the clock assistance with daily personal care. At this point, the person is no longer able to handle a microwave. They are no longer able to bathe themselves. They will become very, very disoriented, very confused, and also they'll start to experience additional physical decline, like disorientation leads to the person being uh, balanced, having their balance off. So more imbalance, more falls, more confusion about where they're going. The confusion leads to them stopping and going and stopping and going. I actually have a patient who forgot to put a foot forward. And so he was trying to actually walk out of the kitchen, and I'm standing next to him and I'm watching him. And this is now, he's like bordering on that late stage. He's still mobile, but I'm looking at him in the kitchen and he's trying to walk out of the kitchen, and he's talking about walking out of the kitchen, but he actually could not remember to put his foot forward. Instead, he kept putting the foot backwards and he kept moving backwards. And so he wasn't expecting to move backwards. And so he would get very out of balance and very confused, like, why am I not moving in the direction that I want to move? So this is one of the reasons why supervision, close supervision, is so important. Experience changes in physical abilities, like I said. Obviously, if you don't know about this, everything in the physical aspect of the person is affected by dementia. And so eventually, the parts of the brain that communicate with your throat, with your stomach, are going to be affected. And so in late stages, you'll start to notice the person having a hard time swallowing, chewing. They'll start pocketing food in their cheeks. They'll start to have difficulty recognizing food in general, or the purpose of food and eating. So hunger will no longer be present. The person will no longer feel the need to eat or drink. And so understanding the concept of grabbing a spoonful of food, putting it in their mouth, chewing, swallowing, all of that, we take it for granted, but it actually is a multi-step process, and the brain will stop to have that kind of capacity to lead the person through the whole process. So they will need to be observed while they're eating, or somebody in near them while they're eating, in case that they need assistance. Um, they start to choke or they start to pocket their food, etc. The next is they'll start to have difficulty communicating. A lot of the words that they're going to say are not going to make sense. A lot of the terms that they're going to use are not going to make sense. At the late stage, most of my patients started to ruminate and focus only on the past. They're no longer able to really understand what's happening in the present. And so I could have a conversation with the person, and it would be entirely based on the past, and entirely based on symbolic language. And so, for example, I had a patient that she would sit with me, and she would just, the whole entire conversation was, well, I know my captain is going to come, and he told me that he was going to come and pick me up. Now the captain was her husband, who had passed away almost 20 years ago. But she spoke almost entirely about that, about this person as in the present. And a lot of the terminology that she used was very symbolic. Um, like she would talk about their pet, and she would talk about their pet like their baby. She would talk about the like her husband has the captain. So I had to learn that the captain was actually her husband, who had been in the Navy. So there's a lot of different things like that. When she talked about her dog, she would say my baby, instead of my dog, or the name of the dog. So they start to mix terms quite a bit, when they start to get into those late stages. Um, the last phase is, usually dementia doesn't actually take the person. A person can have dementia for decades, and it usually doesn't take the person. Usually what takes the person's life ends up being one of several components. Either the person stops having the ability to swallow or process food, or the person will get pneumonia, or an infection, or the flu, something like that, because their immune system is so compromised by the late stage that they are very susceptible to anything that has to do with any kind of viral infection. So those are the stages. Next, what I'm actually going to be talking about today is not, I've given you all the facts that I was going to give you. The rest of the meeting, until it's time for questions, I'm actually going to present to you guys 3 scenarios that are real life scenarios that I've recently worked with. And these scenarios, I've changed the names, but everything that I'm going to talk about is actually true, and they're experiencing it as we speak. So you might find yourself living vicariously through these experiences as I relate them to you. Okay, so the first ones are Susan and Robert. Susan and Robert, are a couple, 89, and the spouse 93. Susan, at 89 years old, had a recent fall and broke her hip. She was not able to she wasn't able to have surgery. She was hospitalized and has been in a rehab. But the children consider that there's a very real possibility that she might end up going to hospice because she's refusing to eat, she's refusing to drink, and she's entirely bedbound. In the meantime, her husband, who's 93, Robert, is in a house by himself. They used to be the sole caregivers of each other. And he's in a house by himself, and he's got moderate stage of dementia. Now, this couple has 2 male adult children. One of them is married with adult children of their own. The other one's married, no children. All of them live outside of the state. They can come into the state. They can come to Florida for very brief periods of time, but they're not able to come for long enough to be the caregivers for Robert or Susan. And so the discussion that we had was determining how can we get Robert, who is still alert enough to say, no, I don't want to go into a facility, to go into a facility out of his own free will, while Susan is no longer going to be there. So now we're experiencing 2 major changes in Robert's life. Susan, his spouse of over 40 years, is dying, and she's not coming back. And Robert's having to leave his house and go into a facility. The children, when we met, and we did a Zoom meeting, when we met, they were very distressed. And the number one question was, how can I convince my dad to be okay with going into an assisted living facility? Um, because, excuse me, I don't think that he can handle being by himself at home. Now, they had discussed the possibility of home health, and we did talk about that during the meeting. So, the first question, I educated quite a bit on this. I educated the family quite a bit on the first concept. First and foremost, Robert is no longer able, cognitively speaking, to make a decision that is so major that is going to determine his living situation. He is not capable of doing that anymore. So I had to really work with the family and help them understand that number one thing is you're looking for your dad to give you the blessing to make this change for him so that you guys can feel like it's the right thing to do. But in reality, he's past that point. He's not able to do that. And they agreed because as I was talking, they're like, you're absolutely right, because we took him to the facility last week when we were visiting him and we were visiting mom, and he loved it. And he agreed, he thought it would be a good idea. And he even said, I really don't think I can do this on my own anymore. But then 2 days later, when we were talking about planning and things like that, he said, what are you talking about? I've never been to a facility. I don't know what this place is. Obviously, I'm not going anywhere. I'm going to sit here and wait for your mom to come back. So they saw firsthand the indecision. So what I explained to them in that regard was, you've done your homework very thoroughly, very seriously. You understand that your father can no longer stay by himself. You've seen the evidence. He is very confused. He's very forgetful. He's having a hard time making decisions. And so now it's not about him giving that okay. It's more about you guys as family understanding that you have to do what's best for your loved one. And in reality, comes down to safety. I've had multiple experiences of family members that have hesitated in doing the transition, and they've had maybe like home health there for a couple of hours every day or something like that. And their loved one has ended up having fire situations happen. I had one person that left the stove on. I had another one that lit a candle and fell asleep, and the curtains caught on fire. I've had multiple fire situations. I've also had multiple fall situations. So I explained to the family, it's about safety and it's about quality. You don't want your dad, who has been with a companion for the last 40 years, to spend the rest of his life alone in a house waiting for a caregiver that's going to come for 2 hours a day. And then the rest of the time he's just by himself, forgetful in his own mind, losing his ability to even figure out the day, the time, the situation, etc. So they agreed with that. Another big question that they had was, okay, so what's going to happen after placement? And that was a big one, because I always remind family members, while the person is at home, while they have everything in the same place where they had it before, where they've had it for the last 20 years, they can fool you into believing that they actually know and remember what they're supposed to be doing. Oh, well, of course I remember that to put my hearing aids on every day because I've had the hearing aids on the same spot in the nightstand and I've put them on every single day for the last 5 years. But when they get moved, when the spouse passes away, when they have to leave their home, that change is going to challenge their ability to adapt and to problem solve. And so you are going to inevitably see a decline. You're going to see more confusion, you're going to see more agitation, more anxiety. So that's a good time to start talking to the psychiatrist and the neurologist on what are the medications, the regimen, and the treatment plan that should come with the transition to the facility so that the person can transition as calmly as possible. Okay, the next one is Bob and Janice, and this is a 90-year-old and 92-year-old. Okay, so Bob has dementia. He's known about his dementia, his Alzheimer's in particular, for some time. I followed him almost through from the moment he got diagnosed. And his wife was his right hand woman. Used to be with him all the time, used to help him, used to guide him, used to cue him. So now she's gone. She's passed away. And he is living independently in an assisted living, but it's an independent living, so he doesn't get any kind of visits from anybody. The lucky thing about this person is that he has 5 children, 2 of which live locally. They both are married and have adult children, so their kids are out and gone. And so the 2 kids that are local actually go and visit him every single day and take shifts in his apartment with him. So one will go for the first 4 hours of the day and get him up and do things like that. And then the other one will switch. And then the days that they can't go, they have a caregiver 24 hours there. Without that, they have said there's absolutely no way that this person could have survived on their own since December when his spouse passed away, because the change of losing his spouse has made the decline of the dementia, of the Alzheimer's, I'll call it by its name, pretty significant, to the point where recently his son-in-law was in the apartment with him and he said, go ahead and take your shower. Very broad statement, go ahead and take your shower. And he noticed that Bob walked into the shower. He went to put his clothes on top of the counter and he noticed Bob first wasn't sure how to turn on the water. Then he wasn't sure when to get in the shower. And then he reminded, it's okay, go ahead, the water temperature's fine, go ahead and step in. And when he stepped in, Bob just did one turn and then walked out. And so we were talking about this and they were like, that's a big change. In 4 months, his appetite has declined significantly. His confusion is greater. His ability to problem solve is greater. So they went from Bob only needing his wife, who was 90, to just cue him basic stuff, to now they have around the clock care, family care around the clock, nurses care around the clock, so that he can stay independent in that independent living facility. The next one is Judy. And Judy is a testimonial of what happens sometimes when the person is living alone and the family does not realize what's really happening behind the scenes, because you will be surprised how well these folks can hide the disease. So Judy was, when I met her 4 years ago, she was 80 years old, female living alone at a 55 and older community. She has, because she's still living, has one son who's married and lives out of state, and she's got advanced stage Alzheimer's. When I was called to go in and work with her, Barrington called me actually. Um, she had been forced into Barrington by the family, and she was very, very angry about it. She was not having it. So she was constantly trying to exit the building. She was very angry, very upset, and she just kept wanting to go back to her house. Well, her family gave in, let her go back to her house. Within 2 months, she had had 4 falls in her trailer. She had zero safety uh, tris- awareness of safety, zero. So she would hear voices when she didn't have her hearing aids on. She would hear voices, she would hear noises, and she would walk out in the middle of the night down the steps of her trailer to look around. And then she would, in the middle of the night, without hearing aids on, walk up the steps and get back into her room. And she fell several times. Well, the family was pretty convinced we need to do whatever it takes. They couldn't come and visit with her, so they had an idea of what it was that was going on, but mostly they thought she was just declining physically. When I went into her trailer in the community and sat down to talk to her and actually had an opportunity to look around, um, most of the things that she had in the refrigerator were expired. Most of the things that she had in her pantry were expired. I asked her, like, do you want me to just throw away some of these things for you? And she became extremely irritated and very, very upset, arguing, what are you talking about? This stuff is good. Everything's fine. So she was actively eating this expired food. Um, she had several stacks of bills on her table with past due and overdue balances from credit cards, from her electric was about to get shut off. And it wasn't that she didn't have money in the bank, but she did not understand anymore what it meant to pay a bill. So I talked to the family. They were in shock. They could not believe it. And we had to force her back into the facility. She was very angry, but the truth is, in all honesty, she would not have survived. Um, whether it was another fall or whether it was food poisoning, something was going to get to her to where she was not going to survive. But the family felt horrible about doing it. And it was a really, really hard transition for them. So I understand, before I close and I allow everybody to ask your questions, please know I know what you guys go through as family members every single day. The struggle to make these decisions is so difficult. There's so much shame, so much guilt, so much anger, so much frustration that goes along with deciding to take your loved one out of the safety of their home. But understanding just what comes along with dementia and understanding that this is a progressive disease, all forms of dementia, Alzheimer's in particular, is a progressive disease. And even the smallest change in the person's life can go from them being fairly stable to having a huge decline. Anything from a cold and a hospital visit so that they can't get up and move around, um, to the loss of a loved one. Anything can make a huge impact in the disease progression, and you won't even see it coming. Before I close, I want to make a mention because one of the questions that Melissa had posed for me last time was, what are some of the ways that families and people themselves can intervene and kind of look ahead in terms of figuring out if there is a diagnosis of Alzheimer's or any sort of dementia. Um, my philosophy is that the early detection is the best form of detection. So just like we're told, after this particular age, get your mammograms. After this particular age, check yourself for colon cancer. Just the same way. After your 60s, going to the neurologist, having a neurologist, or having a psychiatric evaluation, just a simple MOCA, or from your primary doctor, they can do an evaluation of your memory. Make that a part of your yearly physical. Make it a part of just your yearly screening, just so that you feel confident that your memory is still stable. Because the longer you wait, the signs do not show up if you're not looking for them until it's too late. And by that point, then you're in a rush trying to figure out, what am I doing with this person that all of a sudden can't even figure out how to put their socks on. So that's my thought, just get your loved one checked as part of their regular physical every year. And if they do find that cognitive um, ability is declining, okay, let's talk about, what do we do next? How can we keep our loved one as healthy as possible? And so far, the research has shown that healthy eating and movement, physical movement, are the two biggest um, predictors of how the dementia process progresses. Okay, so now I am going to go ahead and show you the last slide, which is just a simple resources. The Alzheimer's Association, they're amazing, and the National Institute on Aging, they're also really great. And I'll stop sharing my screen and just give everyone a chance to ask your questions.
So on the heels of that, Yalily, I do have a question. We have done a couple of webinars now talking about dementia, getting that checklist out. And I really like what you said. And I don't know if this is the first time I've heard this, but that just sent off a light bulb in what you just said, that you should make this a part of your checkup every single year. You have your checkup, you might as well add this to that list. Is there a specific doctor that somebody needs to see or to add to their list of doctors that can help make that diagnosis and can keep track of where you are from the first time they see you each and every year that you come?
So for preventative measures, your primary doctor can do that as part of the yearly physical. It's called the Montreal Cognitive Exam. It's a 1-page questionnaire that you fill out. It takes 10 minutes. So if your primary doctor should be able to do it, and if then afterwards, if something seems odd or if there's some red flags that come up, the doctor might refer you to a neurologist.
Excellent. And I will say, very good real life examples that, we don't want anybody to go through this, but, there may be people out there watching right now or who will watch the recording when that's up and running that can see themselves within those examples. So thank you for sharing those with us. Really very, very impactful, Yalily. And now you mentioned Lewy body dementia very early on in your presentation, and we do have a question from one of our viewers who wants to know, is mania a symptom of dementia? And that can be a symptom that you see with certain types of dementia, including Lewy body, correct?
Yeah. I think you see mania more often during the sundowners phase of dementia. So as part of, um, yes, definitely you'll see it with Lewy body, but you'll see it across the board, I think, once you start to enter that moderate stage and the person's, um, just their ability to understand night, day, things like that starts to shift, and the rhythm of their sleep starts to shift, you will see a little bit more mania because they're going to be up at all hours of the night and they'll be looking for food. They'll be wandering. They'll be, starting and stopping things. You'll walk through the path where they went, and there's like all kinds of things that they've touched and changed and moved around. Maybe they'll start hoarding food, things like that. So I think that it happens the worst when they start to have that sundowners phase where now night turns into day, day turns into night.
Yeah, and one aspect of this that you talked about is those who are the caregivers, and there is a lot of hand wringing, as you mentioned, of what do I do? Is it the right time? Is it not the right time? If someone's watching right now and they are in those shoes, what
Mhm.
advice can you give them?
In the two cases that I presented, one where family is involved, actively involved, the advice that I gave one of them, so for example, the family that has active presence in the life of their loved one, so the one that had the two kids, the kids take turns, things like that. I told them, I said, he can stay independent. You guys are there every single day. You're there for 9 to 10 hours a day, and then overnight, there's always somebody with him. So I said, I don't see a reason to transition him into memory care because living independently, he's already in a facility, so it's a fairly safe environment. There's people all around him. He has safety features, there's nurses, et cetera, et cetera. And the family's heavily, heavily involved. Now, when I have families like the first scenario where they're involved and they want to be involved, but they're not able to physically be present, I often tell them the earlier the better. And the reason why the earlier the better is because the person, while still able to problem solve and while still able to figure things out and adjust to their environment, should, if you get them in there earlier, then they can at least have an opportunity to start socializing, learning names, getting a little bit more comfortable and adjusting. So that's, and in all honesty, if you're relying on home health services, they're so they're just so unreliable because you don't ever get the same person consistently. They don't often have 24-hour care, and it's extremely expensive. So that's my suggestion usually.
And on the heels of that, and by the way, if you're watching and you have some questions and you're just sort of maybe waiting for that right time to get it in, this is the right time to do that. You can scroll down to the bottom of your screen where it says Q&A and type out your questions. You can remain anonymous, and we hope that we can help you walk away from this webinar today armed with a little bit more information that maybe you didn't have when you logged in this afternoon. So when you talk about that home care, and you have been in homes, you have been in maybe nursing homes, you have been in senior living communities,
Mhm.
and you and I talked about this last week, Yalily, that people sometimes have in their mind what something was like maybe 20 years ago, and they still have the belief that, oh well, I don't want to send my mom here because this is a horrible place, and I don't want to do that to her or my dad. But what maybe they don't know is how that has completely changed over the past decade, the last even
Yeah.
5 years. What can you say to those communities that you visit day in and day out?
Well, and I'm going to just begin this answer by saying, you guys don't pay me anything to do this. I share my knowledge free, and I have zero invested interest in any facility. It's not like I hold stocks. It's not like, anything like that. So when I have a person talking to me about placement, I am usually very blunt and very honest. And I've had enough experience. I'm in Florida. I've had enough experience in the counties where I live that I have seen enough facilities that I can openly talk to people about different options. And what I tell them is, as long as you have a healthy communication and a healthy relationship with the staff in the facility, as long as you feel comfortable walking in through that door and knowing that when you find your loved one, they're not going to be soiled, they're not going to be malnourished, they're not, things like that, because you have a healthy relationship with the facility, you can easily find comfort in knowing that your loved one is safe. Have there should be a list of questions that you ask when you go into the facility. You should be looking for cleanliness. You should be looking for, the staff, how many staff per resident, et cetera, et cetera. But things are not like they used to be. And the reason for that is because in all reality, when we come down to it, it's a business and there's so much competition that facilities have learned. It's all about making sure that you treat the residents right, that you give them what they need, you make them feel good so that they want to stay with you. Because these days people have choices. There's a facility in every corner in Florida. Like, it's heaven's waiting room. So the truth is there's a lot of choices here. So things are not like they used to be.
Yeah, and I know that as you mentioned, you are in Florida, and you can help people to a degree, but you are licensed as a therapist in Florida. You are also bilingual, by the way. And before we end the webinar, we will make sure that those individuals watching will have a way to get in touch with you if they have questions, especially if they have loved ones in the Florida area or if they live there as well. So we have a very open question here, and it is, what causes dementia? And I think, we have ideas of what causes dementia, but I don't know if we know exactly what causes it. Is that correct?
That's true. So there's so many different types of dementia. I mean, literally, there's over a dozen different types of dementia. Um, but the most prevalent ones, you have Alzheimer's, which is age related. So that one, what's been found is anywhere from the lifestyle that you led until the late 60s to your genetic background. So if your parents had Alzheimer's, or your grandparents, that's a big factor in Alzheimer's, is genetics and lifestyle. And age, obviously, because it all comes together. Then vascular is anything that may have traumatized the brain for long enough period of time. So a car accident can cause it. In childbirth, you can have traumatic brain injury that can cause it. Then we talked about Lewy body being due to Parkinson's. So there's not one specific thing that causes it. It's just a whole series of situations that come together that create that cognitive impairment.
Yeah, and I mean, that is really an open question, and I think if we really knew the answer to that, we could probably find a way to make it not happen, to make it go away and eradicate it. But we're still working through all that information and all that knowledge. So that is a very good question, though. And Lori has a question, wants to know, how do you know what is covered by the long-term care policy?
Okay, so long-term care policies in terms of Medicaid.
I think so. So let's start there with Medicaid.
Yes. So long-term care policies come into different things. You either have a long-term care policy through a life insurance, or you have a long-term care policy through Medicaid. Long-term care policies through life insurance vary widely, mostly because it's all about what you elected when you chose the insurance. Medicaid, because Medicare does not cover facility care, so you can take that out completely. Medicare is not going to cover a facility. It'll cover the fringe benefits of a facility, like the doctor visits and the home health aid and the physical therapy and psychiatrist and things like that. It covers the people that come to the facility, but not really the facility stay. Now, Medicaid, they will cover, depending on the state, you have a specific stipend. The most I've seen here in Florida is $5,000 a month is the highest that they will cover for long-term care.
And the follow-up was it's life insurance. And as you mentioned, that could be very broad.
It is. My suggestion is that the person give the life insurance a call and explain the situation and ask what does my plan cover, if anything, because you have to specifically select certain things from life insurances for long term. Some will only cover home health, some will cover facility stay, so it all depends on what the plan was.
Yeah, that's a good point. It's not all encompassing for some, and maybe it is for others. But as you said, you have to make sure you do select those things whenever you initially start the policy. So, great answer there. Another question: how long do you suggest we begin? How long do you suggest we begin making the transition before making the move into a community or a facility?
It really okay. So the second, see, the first example I gave of the couple whose wife is going into hospice, I told them because Robert is moderate stages, and so decision making makes him very anxious. I told them, I said, go in, sign the paperwork, get everything going, then take Robert out for a weekend in a hotel somewhere, grab the furniture, put it in the room exactly the way you want it. It has close to similarity to what his regular house looks like as possible. Bring some mementos, things like that in there that look very familiar to him, and then transition him in. And the reason why I say that is because they wanted to get him in and then start the process of talking to him weeks in advance. Well, he's going to forget probably a couple hours after the conversation's over. Now, if he doesn't forget, that's even worse because then he's going to ruminate and then he's going to become very anxious and he's going to go through the whole cycle of grief and loss and anger and frustration all over every single day as he remembers this. So I usually tell people, don't give too much advance warning if the person is already advanced enough that they're not going to be able to change their mind anyways.
Very good tip. Excellent tip, Yalily. Another question here. My mom suffered a stroke. Faculties seemed fine right up until the time of the stroke. It seemed that immediately following the stroke, that signs of dementia apparently appeared. Is this normal?
Yeah, that is actually totally normal for a stroke. Now, the question is, has she been able to recover the cognitive faculties? Because after a stroke, especially if it's a hemorrhagic stroke, you're going to experience some significant cognitive issues. But as the brain starts to heal and new memory pathways start to develop, maybe she has to learn to do things a little bit differently. But if she's recovering those memory pathways or figuring out new ones, that's where you really want to look at. Now, when it comes to strokes, I typically tell the person, keep an eye on them. This is where it's very important. Every time they go to see their neurologist, have them do a memory check because 3-4 years later down the line after a stroke, you will start to see those remnants of that cognitive decline start to show up.
Interesting. Okay. Well, I hope that answers your question. And we aren't sure exactly where the parent happens to be in the stages, whether it's the first year, first couple of months, but that is definitely something to keep in mind. We have another question: assisted living facilities versus long-term nursing care or nursing home care for moderate dementia. Which one?
Any change that you have to put the person through is going to cause significant effect. It's like, cause and effect big time when it comes to change. So do you see the person needing that memory care unit in 6 months? Because if that's the case, go straight to memory care. Don't stay in assisted living just so that they have to be readjusted again to a whole new environment. If you have to make the change, just go where you need to go right off the bat, and then at least they'll have longer time to adjust to that space.
Yeah, and I will say the good news on that end is, you mentioned there are a lot of communities, a lot of places that are there to provide this kind of long-term care, and that a lot of these places have come up with the great idea, as Arbor has, that hey, we're going to allow you to age in place. You can come in living independently, and then as you age, you can, if you need a little bit more help, you can get a living assisted living in the same community. And then if you need a little bit more help or have some cognitive decline, you can move to the memory care portion of the community. So the faces remain the same, the community remains the same. So great answer there. As always, Yalily, you've been such a great resource for our viewers here today. Now, if somebody does want to get in contact you, what do they need to do?
The best way to contact me is probably via email, because I do see patients on a daily basis, so I may not be great over phone. But you can always email me and I'll contact you back. And it's travelingtherapist1@gmail.com. And that's my probably the easiest contact for me. And then we also have our website if you want to know more about us as a company, and it's thetravelingtherapist.net. So that's our website there.
Yeah, and I love the name, by the way. It's something very easy to remember. So you did very well with that selection, Yalily. Thank you so
Like,
much for sharing your knowledge with us today.
anytime. And the last thing I just want to mention is if you are deciding to make the transition for your loved one, I think the facility can definitely help. And more importantly, bring in the team, work with a team. You don't have to do it alone. Bring in psychiatry and neurology and the staff at the nursing home, at the assisted living. You have the resident directors, you have the nurses there, you have, there's a whole entire group of people that are experts in the field that can be a support. So use them. Don't be shy about asking the neurologist, hey, let's have a plan because he's going to be transitioning to a facility. Let's have a plan on how are we going to manage the mood changes? How are we going to manage the transition? Talk to a psychiatrist about it. What medications should we give them? Stuff like that. Use the resources you have available. You're not alone in the process. So that can give you a little bit of peace of mind.
Great way to end it. Yeah, and unfortunately, it is a very common disease as we age. And I hate that that is the case, but it is. And because it is the case, that's the good news. There is a lot of help out there. Reach out and get it. Great
Mhm.
job, Yalily. Thank you so much. And for all of our viewers, a quick reminder, this webinar will be up and running at www.seniorlivinglive.com starting tomorrow. All of you attending today will receive a link to this presentation that you can share with your loved ones. Thank you so much, as always, for watching Senior Living Live. Have a great day, everybody.